TikTok challenge turned deadly for an Ohio teenager. A 13-year-old took part in the Benadryl challenge. That is an allergy medication that is found in many homes. WKYT's Mariah Conjito talked with a Lexington doctor who says even over-the-counter drugs can be dangerous if not used properly.
The parents of 13-year-old Jacob Stevens says he died after he took between 12 and 14 Benadryl pills. He spent nearly a week on the ventilator prior to his death. According to CBS News, people are doing the challenge in order to have hallucinations.
That amount of Benadryl would have not been safe for an adult, let alone a 13-year-old who is likely smaller in size and weight. And so that's why it's so important to follow the directions and the age-specific directions.
Chief Medical Officer of Baptist Health Lexington, Dr. Lee Dossett, says the antihistamine is most commonly used to treat seasonal allergies. People also use it to help them sleep because of its slight sedative effect. He says it's perfectly safe, except in excess.
It can affect your heart rhythm. It can affect, it goes to the central nervous system, so it can cause seizures and really coma and sedation.
Following the incident, this statement was posted on Benadryl's website. It reads in part, "The challenge, which involves ingestion of excessive quantities of diphenhydramine, is a dangerous trend and should be stopped immediately." Dr. Dossett explains some signs of an overdose.
You could present as agitated, confused, seizure, coma, unresponsive, those sorts of things.
He says if you see someone who has these symptoms, call 911. He says Benadryl is certainly not the only over-the-counter drug people should be cautious of, though. He says drugs like Tylenol, Advil, and cold medicines also have specific directions that must be followed.
Those are put there for a reason. Taking multiple pills or a combination of things is very unsafe.
His advice?
Parents really need to be aware of what they have in their house, how it's stored, and then really try to supervise their kids, what they're being exposed to on the internet and social media.
Mariah Conjito, WKYT.
And Dr. Dossett says that parents should store medications on a high shelf that children can't reach, and when possible, use child-proof caps in storage.